Those days, we didn't have ARTs, antiretroviral. Once you're diagnosed with HIV, that's a death sentence. They expect a doctor to be strict, what's your problem? When they say you're going to see Dr. Makanyengo, they expect to see an old, big man. Yes. But I find some get surprised, especially, and ask, are you spiritual? And they're like, why is she asking? I'm trying not to push myself. Remember, I'm retired, but I'm not tired. But I retired. Yes, I'm not tired.
Welcome to Daktari Tone, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care. Hello and welcome to the Daktari Tone podcast, where sounds, voices, and perspectives of healthcare practitioners are amplified. I'm your host, Rian Hilary Kerubo, and today we are going to delve into a vital part in the healthcare system, mental health. Today, I'm joined with a woman who has redefined psychiatry. Her name is Dr. Margaret Makanyengo. She's a consultant psychiatrist who is well-versed with general psychiatry, HIV, and gender-based violence. I'm going to allow her to introduce herself, and we get to know her more, and mental health as well as we learn. And yes, I'm glad you're here. Okay, so welcome.
Thank you, Kerubo. I'm happy to have this opportunity to introduce myself. Like she said, I'm a consultant psychiatrist. I graduated in 1991. I was trained in the University of Nairobi and Mathare Hospital. That's where we were practicing, and that's 1991. And I was posted to Homa Bay as the district psychiatrist. Then we didn't have counties; we had districts. Then that in 1992. I worked there from 1992 to 1995, February, when I joined Kenyatta National Hospital as the head of department of psychiatry. Yeah, so in Kenyatta National Hospital, I learned a lot. I can say Kenyatta National Hospital really built me to what I am, I would say, because as you know, this is a referral hospital where everybody who's sick, whether you're an emergency case, whether you're HIV, whether you have cancer, people would be referred and admitted to Kenyatta National Hospital. And you have so many patients to apply your psychiatry. So in Kenyatta, I headed a department which initially was actually focusing on HIV management and counseling. Yeah. We used to be called Patient Support Center. Okay. Yeah. So this Patient Support Center was actually started because HIV patients, and among other patients and people with TB, they needed counseling. Yeah. So that's before I joined. So I found it's a department that was providing mental health. By that time, they didn't have another psychiatrist. So they established Patient Support Center to counsel people with chronic illnesses, TB, and then HIV, was so much connected to TB. And those days, we didn't have ARTs, antiretroviral. Once you're diagnosed with HIV, that's a death sentence. So by the time I was joining, we found that people diagnosed with HIV would actually jump from the 4th floor, commit suicide, and were killing themselves. It was a death sentence. And the doctors by then did not know how to even disclose to the patient that, I think you have HIV, we need to do tests. What the doctors, they had fear, really. What they would do is that they would tell the patient, there's another test we are going to do, but we are going to send you to Dr. Makanyengo's office in Patient Support Center. They'll tell you more about it. And that then the doctors didn't know, and there were no policies and guidelines on how do you handle patient with HIV. So we are just sitting in the office. You see people trekking in. They look sick. They are weak, with papers, and then referred for HIV test, do counseling. So we asked the patient, were you told what you are coming for? No, we are told to come to you. So we were like, we had to start now, like, okay, the doctor has seen you, have found that you are sick, and some of the illnesses have made them decide to do an HIV test. Do you know what HIV is? So we had to start them from the beginning and then see them through. And then on top of that, follow them up.
Now, before we go ahead, that's a handful. And one thing that even caught my attention is the fact that you said you are the only psychiatrist then.
At that time, yes, I was alone because the other doctor had left. So I was alone by then.
Before we go there, I would like to know that now the Dr. Margaret, the one now behind, being a psychiatrist. But before we do that, I would also like us to get to understand what does a psychiatrist do, and how does it entirely, differ from other terms like psychologist, therapist, counselor. Okay. Yeah.
As a psychiatrist, you go through the normal training in medicine. You have to do your 5 years. We had to do 5 years of medicine. And then we had to do 3 years of psychiatry, our days. But now I think it has been expanded to 4 years, and undergrad. But we had to do all that. So you had to understand your full medicine, understand the anatomy, biochemistry, physiology, all about pathology of our patients, Why? Because medical illnesses, a variety of medical illnesses affect the mental health of a patient. Now, when we are specializing in psychiatry, again, we had to go in to do a dissection of the brain and learn some neurology. We had to learn also some psychology as well. And then psychiatry, now the clinical psychiatry, which involves neurotransmitters, neurological issues, and other conditions. So we had to learn all that before we could actually do psychiatry. Now, with psychology, normally, right now, I think they have basic degree, which is about 3 years, and then there's the clinical psychology where they have to now learn some of the clinical stuff we do. Yeah, but the difference is this: is that now the psychiatrist is a medical doctor who can actually diagnose, do investigations and tests, and prescribe certain medication if need be, if the patient needs medication. Yeah. The psychologist will focus a lot on the talk therapy, the mind, the way the person thinks, the way the person behaves, the environment, and a lot of factors. And it's based on a lot of theories in terms of, theories of development from childhood, of which they apply those theories now in the practical session, but psychologically through talking, through thinking, through behavior. So the two work together, you see, because the psychiatrist may not have so much time to sit with the patient to go through the therapy session, but will come up at least with an assessment and a diagnosis, and then bring on board the team. And it's not just the psychologist who works with the psychiatrist. We also have an occupational therapist. We have other counselors. And when we talk about holistic care, I'll tell you more about the kind of services team that we work with as psychiatrists in mental health care.
Okay, great. At least now we've gotten that. Yes, so we've gotten that out of the way. Now we get to understand what entirely a psychiatrist does different. And for me, what stood out is the fact that now there is, more of prescription and like.
But we also do therapy. You can do therapy, and you may do prescription. And you sometimes have to manage the other underlying medical issue. If somebody is hypertensive and he's psychotic and he's, having another psychological issue, you have to look at the big picture. You can't ignore the blood pressure. It has to be handled, You can't ignore the ulcers. They have to be handled. You have to look at the medication. Do they interact? The pharmaceutical aspect with the medicines of the ulcer. how do they affect the brain and the heart? So there's a lot of the scientific aspect that the psychiatrist has to bring on board when handling a psychiatry patient, a mental health patient.
Now, beyond the title psychiatrist, who is Dr. Makanyengo? If you can tell us a little about yourself, how do you describe yourself, your childhood, your family? Yes.
Sixth born in a family of 7, and I've lost 2 siblings, so now we are 5. And I grew up a very shy child. I actually born in Mombasa but grew up in Nairobi. Westlands Primary School was my school, and I can say I was quite shy. For some reason, as a child, when I look back, I wasn't as confident as I only became confident in campus, I would say. And I like to come open with that, because I have met so many young people who lack confidence. And they think that they don't have a future, they don't have a direction. I didn't have confidence. I could not talk to people in a group, but I did well in school. Yeah. So primary, secondary school, I was okay. I went to Limuru, then Kenya High, then Limuru Girls. Then university, when I joined medicine, that is where now I started gaining confidence. So you can gain confidence and yeah, over time. Yeah.
What brought to that confidence now? What was different from your early childhood to now you finding your confidence in high school?
It's interesting. I think the peers, the people you meet, the work you do, the friends you have. In medical school is where I met now very close friends of mine. And that's where I met my husband. He was a medical student then, and he was in a band of which I joined in my second year. Yeah, so I think the environment, the peers, the friends actually shape your personality. So I can say that helped, me gain confidence. Yeah.
So when was that moment or event that made you realize that psychiatry would become your life's work?
Funnily enough, I believe I joined psychiatry for the wrong reasons, because I was a medical officer. After doing my medicine, I was posted for internship in Nyeri. My husband by then was in the military and was in Nanyuki barracks. Yeah. Then I was posted to Nanyuki district hospital to work as a doctor. So, after 2 years, usually we want to come back to specialize. But in my experience as a medical officer in Nanyuki, I said, I don't want to be a gynecologist, because it means you have to wake up at night and emergencies. It was quite stressful. Yes. I loved children. I would have done pediatrics, but then when you have to keep pricking their hands and they scream in pain, yes. I said, I can't become a pediatrician. I looked at all those things. I said, I think psychiatry is the best, because it gives, at least it's less rigorous. That's why I joined. I thought it was easier. Yes.
So you thought it was easier. Now what do you know?
I didn't have to wake up for emergencies. I could look after my children, relax. It was the most relaxed. Yeah, that was the expectation.
Now what's the reality?
So I joined Mathare Hospital. I did psychiatry. And, the focus there was mostly on these very sick people who pick papers. They have torn dresses and screaming, shouting. They're really, really sick people, like schizophrenics, bipolar disorders, drug addicts, really, really mad people. So I said, oh my, okay, is this all I'm going to do? But let me try to persevere, So I did the course and I finished and I passed. But now the interesting thing is now when I started working I started learning more about mental health and psychiatry, because you find when in the real world, there's no perfectly normal person. Yes. Yeah. Everybody has an issue. So we are not focusing on the guy who's undressed, the guy who's throwing stones, the guy who's picking papers and who's dirty. Many people who are living among us, working with us, our own families, relatives, have some element of mental health condition. So I realized I started now learning so much. And then I also learned that there are other diseases that really require mental health intervention, like HIV, chronic illnesses. And then there are other factors that require mental health intervention, adolescence crisis, gender-based violence, and all this. So mental health became huge. Beyond just the schizophrenic, the one you learned when you're undergraduate.
Yes.
So I realized that we really need to expand that curriculum, and I believe it has now, to incorporate all aspects of mental health. Yeah. So it's an interesting journey. I've really enjoyed it, and I continue to enjoy it. And right now I have a particular interest on holistic care, including spirituality and mental health. That's now my passion.
Yes.
Yeah.
And we are going to get into that because there's so many things that came up about you, and they were making me feel like, oh my god, wow, really? Yes. And I'm quite sure we'll share with the audience about that too. But then so I'm going to ask you an easy question, and then which will ease you up to now also ask me a question.
Yeah.
So how do you usually start your day?
Oh, my day. I retired in 2019. Those days when you are working, you had to wake up at 5, 6, get into your vehicle and drive to work. But from retirement, I've tried to relax myself so that I sleep until around 8, 7, 8. Then get up, pray. So praying is the first thing. Drinking water is the next thing. And that's not for just sick people, for everybody. 1 or 2 glasses of water before you even wake up. Stretch kidogo. Then I now try to have my breakfast around 9:30 to 10. But just maybe if I have to check my mail or anything in the morning, So now my activities right now is from 10 is when now I'm really up and about if I have to go out. Yeah, but online sessions, checking my mail from around 9 o'clock to 10. Yeah. I'm trying not to push myself. Remember, I'm retired, but I'm not tired. But I retired. Yes, I'm not tired. But even if you're retired, you shouldn't push yourself so much. 6 a.m. You're all over. You need to kind of relax.
Yeah. But also you shouldn't sort of do too much of relaxing. It should be there should be a balance.
You need to do something, because when you are retired, people say people who retire and do nothing, they die within 2 years. I don't know if that's a study that has been done. I think I should check that out. But you've heard it, Kerubo. Yes. Yeah, so I love seeing patients. I just love, I do private practice now, because when I retired 2019, but I do private practice at Oasis and other hospitals. And I just enjoy helping people, reaching out. I've also started singing. We'll talk about it.
Yes, we will.
Yeah.
Yes. Okay, ask me a question.
Ask you a question. Yeah. What about you? How does your day start, Kerubo? You're just a Gen Z, not a grandmother like me. By the way, I'm a grandmother.
Oh,
yeah.
Okay. Yes. So how many grandchildren?
9.
9. You're saying it like just 2. 9. That's, oh my God. How does it feel being a grandmother?
Great. Yeah.
Seeing your babies and then seeing your baby's baby.
Yes. And they see me singing and dancing, and they're like, oh, I should get them to join me in one of my songs that are coming. Yeah, I like it. I thank God.
Okay.
Yeah.
So to answer your question, how I start my day. So, it depends. With a good day and a bad day. Bad day, what I mean with bad day is when I have insomnia attacks sometimes at night, I get hard off of waking up so early. But if it's a good day, I wake up at around 7. I stay near work. So I'll wake up at 7. By 8, I'm out of the door. I get to work by 9. At this time, yes, I start with drinking water. I cannot have breakfast in the morning. I have the motion sickness. So when I hit the bus, I tend to feel nauseatic. So I just head to the office. I'll carry my breakfast, like I just did actually for me having breakfast. Yes. And then I'll have it now either in the office or in the field. Sometimes And after that, now I get to know the schedule of the day. If I did know it prior, I just go ahead. And if I didn't, I get to now know how my day is going. I meet for, it depends also with the day. There's a day where I'll meet very many new faces. Sometimes it's super overwhelming.
Exciting.
Yeah, it requires me to recharge sometimes, but it's also interesting to at least meet new people, make new friends, get to understand new experience and personalities as well. Yeah, then I wait for between 5 p.m. and 6 p.m. to head back home.
Okay.
Yes, and get back to now getting dinner, having dinner, or not. Sometimes my eating habits can be really worrisome. Yeah. Then if insomnia attacks, again we go back to waking up late. If not, yeah.
Yeah, we should talk about those insomnic attacks, but
Okay, sure thing.
about it.
We will.
Yeah.
Okay. Now, when we come to you deciding to settle for psychiatry and leaving gynecologist or not going for being a gynecologist or a pediatrician, what were those personal challenges or role models who shaped your path into medicine and mental health?
Like I said, I joined psychiatry, I think, by default somehow. But looking back, I look at as a child, I'm somebody who had concern and compassion for people and justices. And I remember as a kid constantly asking my Mom, why is it that we are the way we are? Why do these people suffer? Why do, for example, black people suffer more than the people? Why are Africans not like, the other Western countries? Why is there a difference between this family and that family? I kept asking, and my poor mom would, sometimes she was struggling to answer. And I was so compassionate. I was curious and very bothered to see that some people suffering. Why should people suffer? Why? Why is the world not balanced, that everybody is the same,
And what would mom say?
And I just can't remember. Sometimes you say just some things we can't answer, some things we leave to God, So I realized I had compassion for suffering people so in me, in my personality, when I look back, I realized I had that calling. Then I was determined to be a medic because I remember once I was sick when I was a kid, I go to this city council clinic. You queue for so long. Then you see a doctor. The doctor never looked up to see me at all. I just walk into this office. Yes, what's your problem? Yeah. Okay, go and get medicine. He didn't even look at me. He didn't. And my heart sank. I got the medicine. I said, I must become a doctor. And not just an ordinary doctor, a doctor with compassion. When I look back.
A doctor who now looks at the patient.
At the patient's needs. And that's really, I feel it was a calling, because there's some callings where you're called, you do something you don't realize at the time, but later on, when you look back, you find, this is really where I am. Like right now, I see this is a calling that God must have had this plan for me before I was born, and I really feel it right now.
Okay. And how did you balance, academic demands, your, emotional stress, and also personal, life during those early stages, especially the fact that you also mentioned that you didn't get to really know, you thought that now not choosing to be a gynecologist will not have a lot of night emergencies, and then now being a pediatrician, there's a lot of pricking and children crying. So you decided to go for psychiatry and the mental health, and then you now get to find that, Ukupia, there's a whole lot of work.
Because mental health, by the time you see a client, you're carrying a lot of baggage. Now imagine you're seeing 3-4 clients. You've hardly even recovered from the first or the second. But what has helped me so much is my husband. I married a man he's a doctor, he's a surgeon, retired, a military retired surgeon, but he was supportive from medical school. We actually got married when he was an intern. I was still a medical student, but I met him in medical school. From the beginning, he was supportive. And he actually mentored me in so many ways. So I think he has been the pillar. Up to now, he's still the pillar. Even now, he's still the pillar. I do my mental health. I don't really go for therapy as such, because they say all mental health specialists are supposed to go for. But I think that he gives me support, though I think I sometimes feel guilty that I should really now stop burdening him, but him and also the spiritual aspect. Being spiritual has given me some kind of resilience and comfort and support. Yeah. So I'm looking at God and I'm looking at my husband as the two key people who have support, and my children. They're amazing right now. They're really amazing.
So how, because you've mentioned that you had a supportive system, of course, that includes your husband.
Yes.
But then you didn't necessarily for you go to debrief somewhere else.
I did do some debriefing. I know during the 2000 there was a horrible war in Sierra Leone where the RUF, they were called RUF rebels, would capture people. They were kids who are now managing these gangs and militants, and they would amputate arms. And we went as a team. I led the Kenyatta team, mental health team, and with a military team. Then we had the military doctor. So we went and we did a lot of counseling, and we did do debriefing amongst ourselves. We had to, because otherwise you become like a zombie. You cannot work anymore. But right now, I can say, for me, I think there's a grace that God has given me, and in the processes of things I do and the prayers, I think there's divine debriefing. But ideally, we should go for support. We should go for help. We should go have regular sections where, as professionals, we actually sit, and occasionally we do, and just share out cases. This case was like this. And those case presentations form a good forum to be able to debrief. Yeah. Okay. I don't think we do it as frequently as we should. But as mental health workers, we should. I'm saying that because the mental health workers who will listen to me, I wouldn't want them to follow my path. I'm lucky that I have a supportive spouse and supportive family, and then the spiritual aspect, Yeah.
Now, I'm still going to take you back because I feel there's still something missing in your answer, but you can prove me wrong. So I want to take you back to young Dr. Makanyengo, okay? So, at least right now, I'm assuming, though, I might be wrong, you find that now you've retired but not tired, so there's not too much on your table. But then the young Dr. Makanyengo was now figuring out life, figuring out marriage. Now children are here. So how did you get to really balance now having this on your plate, now dealing with your own personal life, and then now meeting for, I think even that time maybe it might have been more patient with various issues. What is that thin line of separating that?
Yeah, by then we were able, because I headed the department in Kenyatta. We had more doctors on board, and we had psychologists and counselors. So you didn't have to do all the work. So that allows you to have work-life balance, because you can't see so many cases in a day, So we had a limit of, you need to see a maximum of 4 to 6 people in a day. So that is one thing. And so by the time now I was this young active psychiatrist, at least we were able to cope with the more doctors. And there were not as many complicated cases like we have now, what with social media, AI, and the world going upside down. It's more complex right now. Yeah, but one thing I know, so we have more psychiatrists, which is really good, although we don't have enough. But we have more psychiatrists in Kenya. So a lot of the clients are going to other people, and then many psychologists. And then some churches have opened counseling departments, just lay counselors or really spiritual counselors. They're doing a lot to help people. So the burden, I don't feel it as bad as,
So one thing that came out that why I asked that question is also for other psychiatrists who could look up to you, how you dealt with that at that time. And you've mentioned something really important, work-life balance. So to wrap this up, I have 3 fun questions, and I'll be asking you one as you ask me one.
Okay.
Okay? Yes, so are you ready? Okay, so my first question to you is, what is that something about your personality or background that surprises people when they meet you?
First of all, my name. When they say you're going to see Dr. Makanyengo, they expect to see an old big man.
Yes.
But they find a lady, And then the fact that maybe I get surprised, like when I ask them, my clients, I ask them, about more things. I can expand the questions beyond just the illness. I've come with a problem of sleep. I'm going to ask them everything, where you work, how your relationship, which ideally should be what most mental health people are doing. But I find some get surprised, especially, and ask, are you spiritual? And they're like, why is she asking? So yes, so that is one thing that really surprises people. And then also, maybe they expect a doctor to be strict, what's your problem? But then there you try to be warm, you try to let the patient feel like they're with you at the same level, and that you're not a high person sitting on a high chair. So I find that also surprises people. Yeah. And you?
For me, I think with what you've mentioned, you share one thing when it comes to the name. So yes, mostly when I meet people, they'll be like, I expected a guy. My first two names are male. They're unisex names, but most people, they equate it to be a male's name. So I'll meet people and be like, wait, you're female. I'm like, okay, sometimes I get pride in it and I'll be like, yes, she's the man. But then, that's one thing that stands out. That equates to your, the thing that surprises people. Because, of course, if you just tell me, go see Dr. Makanyengo, of course, I'll expect it to be a man.
And a man,
and an older man, the name sounds. Yes. But one thing also that surprises people for me that really stands out, and it even gave me something to, define myself as, is I'm introverted. As much as I talk too much, I'm very introverted.
Really?
Yes. So I always say I'm a talkative introvert.
Okay, that's interesting.
Yes.
Nice.
Yeah.
Yeah.
So that was a question for me. I do not agree. You have to ask me a question.
Another question.
Yes.
Yeah. You're very young. What made you decide to go into this your profession right now as a Gen Z?
When I was young, I have a very fun story. When I was young, I was this kid who I was already told I was very introverted. So I would be in my own spaces, in the bathroom or something. I used to watch a lot of movies, yes. But then I'll be in the bathroom thinking like I'm acting or something, talking to myself and acting something, or a favorite actor, or a favorite anchor, and I'll just do it. And every time my mom would keep on saying, hey, this one must be on TV. Yeah. But then among my dreams, one was to be a pilot, of course, and then being a journalist was the second, and then the other one was inspired by my dad being a lawyer. But then when I passed KCSE, which mostly now determines which path to take, journalism came in as first, and I was like, yes, wow, I'm going with it. Yes, and I did, and I really love what I'm doing.
Yeah, you look a natural journalist.
Thank you so much. It makes me to meet amazing people like you.
Yes, thank you.
I will tell you that my experience, at first I usually thought, older people than I are so, scary. But to be honest, I've met most, and I'm like, wow. It's just that when you don't get to know someone deeper, you will really judge them wrongly.
Yes,
but then the moment you just get to meet them, even if they are older, even twice or thrice, and you get to talk to them, you still realize they still even the youthfulness in them. They were once there where I was, and they will tell you stories, and you'll be like, oh wow, okay.
Yeah, you don't judge a book by its cover.
Yes, but then when you grow up is when you get to realize that. Because you're also now becoming the older person too. So you look back and you're like, wait, I used to call people 26 years. I'm like, hey, ni mzee. Now you get there and you're like, okay. Yeah. So it's amazing.
But what I know about myself, I just feel whatever age I'll be, I feel young at heart. Like I can play a game. Yes. I love games. I love young people. I love interacting with young people. Sometimes I feel like they are almost like my peers. I'm like, is that normal? So I think feeling young also keeps you somehow young. Yeah, being young at heart. Yeah.
So my next question to you, I already feel I know the answer to this.
Okay.
But I don't know. So if you aren't in medicine, what would you imagine yourself doing?
Now, when I look back, I would have probably just done pastor, being a pastor.
Yes.
Yeah.
I was right.
You are right.
Yes.
Yeah. I just love, there was, before I got to have a relationship with Jesus Christ in 2012, mine very dramatic. When somebody would just say, "Oh, I've finished college and I'm going to do theology," oh, my heart would sink. I said, "Oh, why waste your life, theology?" And then from 2012, I just, it's the opposite. I started doing theology, but I was ordained 2019, and now I understand why.
Do you have a question for me?
No, I have not thought of a question yet.
Please think for over.
What about you? What if you weren't going to do journalism? What would you have done?
I think I would make a really great lawyer.
Lawyer.
Yes.
And you look like a lawyer would be compassionate.
Yes.
I don't think you would defend criminals.
No, I wouldn't be a liar.
But you might support an NGO taking care of the young,
the ones who are
That's
not
what I
able
see in you.
Thank you.
Am I right?
Yes.
I've not met you before, so I don't know.
Yes. I have empath even in my area of my specialization as much as I'm a journalist is in health.
Oh,
yes.
Okay.
So that's why you're even here.
Yeah.
Yes.
Okay.
So
you did some health training?
Not really, but with my experience, it has, you get to want to know more. Yeah. So it has given me more hunger in getting to know more about health conditions, how to even talk to patients, and even just getting the human side of their stories. You listen to people's stories and you just realize how life.
Yeah,
but then again, still miracles happen through it, and there's still that side.
Yes.
Yeah. So.
Yeah, that's good.
Okay, so my last question to you is: what was then and now your go-to strategy to recharge after a tough day at the hospital?
Oh, okay. Normally after a tough day, I get home. I just get home and I sit down. Sudoku. Sudoku. But there's a game I like. It's called Bust the Balloon. This balloon.
Wow.
I like that one. And then the word. It's called. The word, the online word, yes. But I like games. But then I was at risk of that addiction, so I had to limit it to at least let me play for 1 hour. Then I've got to now exercise. So I exercise. I used to walk and all that, but now I found the best exercise is dancing. I put the best videos, including my song. Yes. and I just if I put 7 of them, I know I've done 45 minutes. And I'm okay. So I do dance exercises. Yeah. So then now cooking, cooking, yeah. And then in the evening, I could join, maybe an online meeting or Bible study or watch a movie. Or usually I don't watch many movies, just weekend. I used to love movies. I don't know what's happened to me nowadays. But weekends is when I can watch a Netflix movie or something. Yeah. Yeah, and then make sure I sleep, but I sleep late, unfortunately, around 11:30. Yeah.
Okay, great.
After praying, prayer is very important.
Yes. So I'm getting your hobbies. You've mentioned a few of them.
Yes.
Watching a movie, but then you've said that has also changed. Dancing.
I love singing. I didn't know until the other day.
Yes.
Yeah.
Okay. Okay, great. A question for me?
What is your hobby?
My hobby? Well, I love to draw. Yes, I can draw. Also write poems sometimes, which mostly is based with my life, but I don't share. I just write it. It's more of almost like, a diary, but now in poetic form. What else? I also love to watch a movie.
Yes.
Yes, I love to watch movies so much. Actually, I think that's my number one.
Okay. That is exciting.
Yes.
Yes.
So we've come to an end for this segment.
Okay.
And thank you so much for the stories that you've shared. We've got to learn at least the Dr. Makanyengo behind, the Makanyengo before the doctor.
Yes.
And it's really interesting to get to know you in that light.
Yes.
And that's it for this segment. I hope that you get to join us in the next segment, where we're going to talk more about leadership, innovation, how work more in mental health, ministry, and just get to know more a little bit about Dr. Makanyengo. Thank you.